Alrighty, so today we'll be doing an enteral feeding on a patient. This patient specifically does have an NG tube, but some patients have peg tubes, different types of feeding tubes. So before I go in, I'll verify my provider's order, make sure I'm doing it on the right patient, check their allergies. So I'll go ahead and go in the patient's room. Hello, how are you? My name is Catherine. I'll be your nurse for today. So before I do that, I'll go ahead and prepare my feeding. I'll put it, sometimes they come like already prepared, or if not, like put it in a bag. So I'll have all of that ready. I'll have it primed. If you could verify your name and date of birth for me. Alrighty, so this is the correct patient. Any allergies to anything? No allergies, alrighty. Go ahead and sit you up in a high Fowler's position. That way, whenever you're receiving your feeding, it helps, and making sure that you don't choke or anything like that. Alrighty, so we'll go ahead and we'll have the tubing primed and everything, have the feedings ready, and a lot of times if it's like a continuous feeding, it'll be put in like the continuous feeding pump and get all of that ready. If it is continuous feedings, I'll check for residual, usually about 4 to 6 hours. If it's more than about 500 mils per that time frame, I will stop the feedings, but if not, the feedings will continue. So I will go ahead and check placement. So making sure that I aspirate. So there is gastric content, so it is in the upper area. So we'll go ahead and hook that up. And we've got it hooked up. I will go ahead and get about 30 mils of water. That way we flush it, because we want to make sure that the patency is good and it doesn't occlude. So we've got the 30 mils in there. We've got it covered back up. Alrighty. So we'll hook it back up, or we'll hook it to the continuous feedings, and get all that ready. Alrighty. So the patient is sitting comfortably. The continuous feedings we will change every 24 hours. And every time we check for residual, we'll, check, make sure that it is still in the correct area, making sure that it's not more than 500. If we do, then we would have to change, or go ahead and take or unhook them from the feeding. And with it being continuous, we'll flush it with 30 mils about every 4 hours or so. And making sure that it does not occlude the feeding tube or the NG tube, peg tube, whatever it is. So, alrighty, I'll come back and check on you in a little bit. Alrighty, so I'll document the feeding, when it was started, what type of feeding it was, depending on what the provider ordered, how often it'll be changed or checked. I'll do residual, making sure that I flushed it, and that the patient was positioned in high Fowler's when it was inserted. I verified their allergies. I'll go ahead and make sure that the patient isn't nauseous. I'll document all of that, and I'll continue to assess the patient and come back and check for residual every so often, and flush it every so often to make sure that everything is going as per doctor's orders. And I'll continue to assess the patient.